Good afternoon, everyone. This is Scott Bogren. I'm the Executive Director here at the Community Transportation Association of America, and I'd like to welcome you to our virtual town hall focusing on response to the current pandemic from our non-emergency medical, our specialized, our members that are serving seniors and people with disabilities, serving veterans, kind of the specialized service populations plus our NEMT members. Um, I wish we were all meeting under better circumstances, but the fact is that uh, all forms of community and public transportation have a role to play in helping our fellow citizens in this time. And we as an association want to make sure that we're here to assist you and to get answers to the questions that you need. I wish I could tell you that uh, our staff, four of whom will be actively involved in this discussion today, and myself have all the answers, but we do not. But what we can do is get you the answers. And so we're viewing these sessions as a time for us to kind of share concerns, hopefully where we can identify trends and we can assist you. Um, for many of you, you may have seen a Google form that was at the end of your invitation once you registered. As well, the Google form will be linked in the Q&A box here. That is an important form that we'd like you, if you have a little time to fill out, to share with us data points that you're dealing with. So ridership increases, decreases, funding lost, contract revenue lost, numbers, things that we can then use to work with our partners on Capitol Hill and work with the administration to try to get repaid to you. Service changes, hours, days, intentions. Are you moving more towards doing more delivered meals? Are you not doing services that are non-essential, but really focusing and being asked to do more essential services? We'd like to hear about those kinds of issues. Third, are there any deadlines, regulatory relief? We've been largely, as you'll hear, working with the Federal Transit Administration, but we also have some ability to try to work with CMS and others. So are there regulatory relief that you could use right now so you could better serve your customers? And lastly, we'd like to hear about how you're dealing with your frontline employees, your drivers, or the drivers that are that are providing the services for the work you do, for their safety, to make sure they're being paid, those kinds of issues. So please use the Google form to give us that kind of information. I'd also point you to the Q&A box at the bottom of the screen. Please post questions, and you can begin posting questions now. We want to use this is going to be about a 45-minute call. We want to use the last 25 minutes or so to address questions. So please feel free to fire away in the Q&A box. I'd also point you to, we have put together a list of resources at the URL that you see on your screen right now. These resources are there for you to, and we're updating regularly. So the latest from CDC, the latest from state DOTs, the latest, there's a lot of sharing of best practices that we're picking up from our members. All of that is there and is going to be updated regularly. I'd urge you, once we've gathered the questions from this session that we can't answer, and we start to go out and get answers from the relevant organizations, we'll be posting those answers there on that website. So please regularly check back there. Next up, Taylor Clockey on our staff will be talking to you a little bit about our work and what we're hearing in terms of economic packages moving through Congress and our ability to get into that third one, which is going to be the big one. I will then talk a little bit about FTA, although I'm not sure that is completely relevant to everybody on the call, but I'll give you a sense of what we're hearing from them. And I'll ask Alex King on our staff to give a little insights into maybe some ways we can work with CMS and HHS and others to help you. Chris Zeilinger will then try to bring everything to a close in terms of the presentations, give you a sense of what our next steps are as an organization, and make sure that you are well aware of kind of what we're going to do with the information that we're gathering here today. And then we will go to the Q&A. So with that, I'll turn it over now to Taylor.
Thank you so much, Scott, and thank you all for joining us today. So at the beginning of March, Congress began drafting their relief packages. On March 6th, phase 1 of the relief package was signed into law. This package was worth around $8.3 billion and addressed the immediate impact of the pandemic. Funds from this package are now being flowed to the states. On March 16th, the House passed a revised relief package, or phase 2. The original bill that they had passed had technical errors in it, so this revised bill was fixed and passed unanimously in the House. This package largely focuses on paid sick leave for employees and employers who are directly affected by COVID-19. As of right now, the Senate has not yet voted on this bill, but we should expect a vote sometime this week. The newest relief package, or phase 3, is being drafted by the House, Senate, and the administration. This package is important for us at CTAA and very important for our members, as it includes supplementary relief funding for all transit systems. And one thing I want to stress here is that this is new funding that would flow through existing FTA formula programs. If passed, we'd expect these funds to come as they would traditionally. And again, it's new money. This bill also includes grants and tax incentives for key economic sectors, including healthcare, travel, and hospitality industries. Leadership is hoping to pass this phase 3 package within the next 2 weeks, but we heard right before this webinar actually that the Senate will introduce, or most likely will introduce, their own version of this bill and pass it sometime this week. So as most of you have seen in the news, this package will exceed $1 trillion likely, as it's providing large-scale economic relief across America. So Scott, back to you.
Thanks, Taylor. As I mentioned earlier, I have been discussing these issues with FTA leadership, from Jane Williams to all of the leadership at FTA. We are talking actively with them, and they are engaged and understand the severity of what many of you are facing, and want to come up with ways to assist, which is a good thing. I know not all of you are FTA funded, but that is for CTA the majority of our members, and we will work with those who are not FTA funded to find and work on similar solutions through your agencies. Right now, we kind of have thought through, and our work from here is largely around trying to make sure that we get a hook into this additional funding. We know it's so vital right now. Second, how we can help people be repaid for cleaning equipment, all the kinds of things that go along with that, as well as kind of overtime for employees to clean vehicles and surfaces and all the things that get into that. We obviously need some word on how some of these funding sources will be able to be used to pay for drivers and frontline workers to make sure that we can keep them and sustain them through this, because this will end. And at that point, our services will go back into a new normal, and And obviously, we're going to need drivers. We're going to need the quality frontline staff that all of you have. And then lastly, are there deadlines? Are there regulations that need to be relaxed as to allow for you to deal with these things? So we're working along those lines with the Federal Transit Administration and with others to make sure that we can get those answers to you. Alex, in terms of other issues that are more central to kind of NEMT, have you heard anything?
Thanks, Scott. I think there's a couple things that we've heard kind of come through my inbox recently, some of which are around limiting restrictions on training or certification if there's a greatly increased need for additional drivers. Others are around, funding changes or, social distancing and what that does for ridership and demand response trips that often coordinate rides. So we can get into those a little bit more during the kind of question and answer portion of this. But we know that our NEMT members specifically have some unique challenges with this pandemic, and I would encourage you to submit your questions in the Q&A box for us to think through and to share with our partners, both at the FTA and then also through our colleagues and our partners that we work with the CMS with as well, because I know some of those questions will likely need to be targeted there. So just want to put that out there.
So Chris, why don't you take us through kind of a wrap up on where this is all seems to be headed?
Okay. First, I want to kind of start where kind of you left off, Taylor, that the currently pending and soon to come recovery and response measures passing through Congress are probably the most important things. On the one that the administration and Congress are just now starting to frame. First of all, the top line number that we keep hearing about in the news media, many of you probably hearing this yourselves, is something around $1 trillion. That's a lot of money. It's probably not all going to go to transportation. There's a lot of very compelling social needs, especially in terms of economic disruption that need to be made whole. And some of you might have some experiences around economic disruption that you need to share with us through the Q&A box or through the Google form that we've asked you all to fill out if you can. In particular, we're looking at what are the needs in and around transportation services that are being otherwise at risk. And so that, in my mind, kind of falls in a couple categories. One is, are you and your peers experiencing loss of revenue? And whether that's formula grant funds that you're receiving, local grant funds, contract revenue, whatever, definitely we need to get some handle on revenue losses. And in terms of time frame, we're looking at short-term losses because it's really hard to predict what's going to happen over the long term, although the 2 or 3 year economic perspectives for our country aren't really looking super rosy right at the moment. But at least if you can project some short-term losses that you're experiencing, that's one area. Another area to be looking at is where you're incurring increased costs. Now that covers a whole lot of possible things, especially when we're looking at medical transportation or paratransit services, if you're in the public paratransit environment, or others where we're doing a lot of one-on-one transportation with particularly health compromised groups who may in some cases even have already been exposed to the coronavirus and we don't even know it. So we're having to take extra precautionary measures. Plus we're just closer to them, so we have to do more things in terms of cleaning, disinfectant, that kind of stuff. We may also, given the populations many of us are serving, might even have increased costs because one, I'll say, quote, downside of social distancing is that rather than grouping trips, we might have to do a lot more one-on-one transportation, which of course is a heck of a lot more expensive to do in many cases. And so what's the added cost there? You're still being expected to provide the service, but it's costing you a lot more just because of the basis. Another category we're looking at is increased costs through the supply chain in terms of looking at, again, cleaning, disinfectant stuff, training costs, your own vendors, are they able to satisfy what you need? So the supply chain costs. And then finally, and again, given the populations we're serving and the kinds of services we're providing, our own workforce issues. Transportation to, that's medical transportation, that's paratransit. I mean, it may not meet the classical definition of frontline healthcare, but it's pretty darn close. And in the healthcare field, we're seeing a lot of examples already where workers are either having to take time off because they're getting sick themselves, ideally not through coronavirus exposure, but in some cases that might be happening, as well as workers who are having to take time off because of family situations. Maybe it's a health thing because of having to look after the health needs of a family member. More often, quite honestly, what we're hearing the most of are folks that are having to take time off because, with schools being closed for weeks or months or the remainder of the school term, someone's got to be at home with the kids. Maybe the child care arrangements have also evaporated. And so what's a parent going to do? So you might be experiencing some workforce issues. You might also be experiencing issues of how to onboard more workforce. And we'd love to hear some of the things around there. So there's a lot that we'd like to kind of see in the if you put them in the Q&A, if you let us know via the Google form that these are your experiences, this is where we're suffering. One thing I'll mention again around the currently being drafted relief bill is that whatever new money comes into our programs, it will probably be added to existing programmatic structures. In other words, I kind of doubt that any of us would be given a grant opportunity like, oh, here's new money, here's how you go apply for it. But rather, it's more likely that you'll see your funding sources, be they federal sources, state sources, local contracts, will get some additional funds as a result of this that hopefully will then flow to you. So, but we'll see. We don't know exactly what the mechanism is going to be. But those are kind of the things we're expecting. A couple other things just in terms of policy related issues. One area that I'm curious about, I know we've been talking at CTAA with some of our rural and urban public transit members earlier this afternoon on some of these things. But for this audience, at what point is it acceptable practice, or how do you go about prioritizing service? If you're having to do less service to the population with greater needs, what are the parameters in which we can prioritize certain types of service over others? For instance, if you're doing public paratransit, that might be a very burning issue of how can I do that without tripping civil rights violations and so forth. We don't have an answer to that, but if those are the questions you're seeing, we need to hear those questions and ideally get some clear answer early on from our federal partners, or realize that this is something we need to kind of work through. So those are the kind of the broad brush issues that we're seeing. And so we really want to kind of open it up to really responding to some of your particular concerns. And at this point, I'll turn it back over to Alex King from our team to really kind of field that kind of an open Q&A session where you'll respond to what you've put in the Q&A box on this webinar or other questions you provided to us.
Great, thanks, Chris. We've received a couple questions so far, and I do want to start off by just commenting that if you, just a reminder to fill out that Google form, if you've received guidance from your state on NEMT policy or on certain things, we'd love to hear what that is. Medicaid is a state-by-state managed program, so some of those things will vary state by state. So definitely, keep us in the loop on what you're hearing. One of the things that I do want to bring up first that I think is probably going to be one of the biggest challenges many of you are facing is the fact that they're asking Medicaid clients to be transported individually due to safety concerns and spread of the virus. I think that I don't have an answer for that. That unfortunately is not surprising to me as an individual that has studied public health and works in the health field. But, I'd love to hear your guys' ideas through that form or through comments on, is it increased funding for those trips? What's the best way to support you all as providers in these circumstances who are providing those kind of like very important trips to healthcare appointments. So we definitely hear you and see those comments on that point. Some of the other questions that we're hearing are around relief for providers who do not use FTA funds. I have received a few questions on funding available through the Small Business Administration. Chris and Scott, I don't know if you want to jump in on if you've heard from any other funding streams or support for people who are providing transportation that don't use FTA funds.
Well, this is Chris. I'll chime in first, and then Scott can correct everything I say to make sure it's the right answer. Certainly a lot of the work the CTA does has been on this particular issue has been in the FTA centric space. So I apologize for any ignorance on my part. A couple things, as you were saying, Alex, is that if you are a private business and you are facing severe hardship or need some or cash flow issues, whatever, the just passed the initial phase of this bill included some relief being passed through the Small Business Administration. We are not SBA experts here at CTAA, I'll be honest, but we will try to find information so that those entities that need to go that avenue, just to keep your doors open and keep making payroll, can go that route. If you're a transportation provider but not with FTA funds, basically let us know what your funding streams are, and to the extent we can kind of help point you in the constructive direction, we will do that. One thing, for instance, that has been discussed as part of these last two relief bills has been increasing the federal share of money that's going into Medicaid, so that states will have not have to shoulder the burden of increased demands themselves. And again, that mechanism is kind of a very broad brush approach, and then the details are left up into the hands of states. But if the bulk of your money comes through Medicaid-related contract revenue, we can at least explore those possibilities with you to see what that might mean. Otherwise, quite honestly, we need to hear your story so that we can come up with the best answer for your particular circumstance.
Great, thanks, Chris. I know this kind of feeds into what we were just talking about, is kind of the concerns of safety for riders and drivers in terms of the disease. I think we're seeing a spectrum right now of what providers are doing, from anything from business as usual, still transporting riders, to questioning whether or not they should be in business because of fear of spread of the virus. There's not one kind of guidance on this. I would just encourage you to be in contact with your public health stakeholders and officials in your community, because they're tracking this, they're keeping very close attention, and may be able to provide insight as well. I would be curious if you can share in the chat box or in the Google form, if you are transporting possible or confirmed COVID-19 patients, how are you protecting your operator safety in those circumstances, working on that cleaning aspect? I know that individuals that do Medicaid and medical trips will be on the forefront of those providing these specific trips to their medical appointments. So what you do is very important, but I'm very curious in that regard. On the cleaning note, that we received a comment, Randy, thanks for submitting it, on the challenge to procure disinfectant supplies for vehicles and employees. We definitely are hearing that across the board, and I'll let Scott and Chris jump in on some of the discussions we've had so far on that request.
Something that we've seen, we're hearing from all of our members, and we are attempting and will attempt to establish the work we do as a priority. Stay tuned to the webpage. If we can get links that work off that, I think that would be best. It's clearly, though, not easy. We have, in our earlier discussions today, we have some members who have masks that are using them, and then others would be putting in the question box that they can't get any of them. So all of those issues are very real, and ones that we're attempting to get some clarity on.
Thanks, Scott. There's a couple questions coming in, focusing more on funding again. What if the federal funds you receive are as a subrecipient? I'm assuming that is what that question is referring to. What's the mechanism for distribution? I'm not sure there's an answer for that yet, Chris. I don't know if you've seen anything in the funding bills that we've seen so far about distribution for subrecipients.
I think what I've picked up, and again, this is all a kind of a moving target, nothing is nailed down, is that the general preference of Congress is to use existing structures wherever possible for funding. So if you receive funding as a subrecipient, again, thinking about a lot of our members that get some of their funding through their state departments of transportation, if that's the pathway that you get your kind of routine funding, that's probably the pathway that any supplemental stuff will have the opportunity of coming to you, we think, but we don't really know. We'll kind of have to stay tuned. Right now, we kind of need to know what what your needs are in terms of what that funding needs to be, because it's great to be in the position of saying, here is $1 billion that we need to get in y'all's hands. How do we do it? But first, we need to say we need the $1 billion, and here's why. Part of that also gets back to some of what I was describing as supply chain issues. A number of you are raising questions about protective gear, personal protective equipment, and so forth. And this is a problem throughout the healthcare space. I was reading this morning about how frontline healthcare workers in Washington State are having to make their own masks because they can't get basic surgical masks, never mind N95 respirators, and they kind of need them. Not that we don't, but they especially do. So I think that part of this will really depend on building and strengthening some relationships between you all. And if you're a medical transportation provider, work with the places that that your customers are going to, the destinations, the origins, and so forth, to see how can we make sure we're all in this together around some of those needs.
Thanks, Chris. Very helpful.
Just run through some of the questions as I'm seeing them come in here. I see Christian asks about human service providers and kind of what they can do to support NEMT providers.
Great.
I think, Christian, that's a really good question. And I think the best thing I can say, and I think we're seeing this from some of our members that we've been speaking with, is kind of prioritizing trips and obviously minimizing non-essential trips, but communicating that some of the trips, whether it's a dialysis trip, for example, or a chemo, or the kinds of things that I know the folks on the call are doing that can't not go, that kind of, to use a medical term, triage is very necessary right now. And I think one of the best things that a human service agency can do is kind of engage in that alongside its NEMT, so that there's an understanding of when we're asking for a trip, it's because it meets one of these priority levels, and it has to happen.
Thanks, Scott. There's a couple of questions, again, going back to that social distancing and the distance requirements around minimizing service based on ridership and the use of smaller vehicles, or I know Kristen jumped in with dialysis centers requesting one patient at a time. I would encourage you to talk with your healthcare providers, honestly, about the size of your vehicles. If you have vehicles large enough to fit individuals with that 6-foot distance, that might be really informative for them to know that. If you have smaller vehicles, it may be important to figure out ways to work on that funding piece to support the individual rides. But I wanted to bring up that we saw both of those, and I don't have an answer right now on that, but it is something we've heard across the board from our members. That is a consistent issue, especially those of you that kind of blend funding from different sources. Let's see. There's a question up top here around using emergency response team members to provide transportation if drivers are affected by the virus and there's not enough of them to provide trips. Chris or Scott, do either of you have comments on kind of either limiting or changing training or certification requirements for drivers?
Karen and I had talked about this, and I'm glad she poses this question. You know, for many of our operators in this space, drivers are at a premium, and finding drivers is not a guarantee. And so they don't just grow on trees. And when, if drivers are impacted by COVID, either because they are infected or a family member is infected, it's a very real issue. Karen, I would urge you to do some of that prioritization of your trips, and make sure that, as you mentioned, if you've got to use and you need permission to use some of your other team members to do trips, I would just communicate that that's what you're doing. And it seems there's a lot right now, and it's a cliche, but you need to make it, if it's a priority trip, it's got to happen, and that's what we face when we're talking about NEMT in many cases. So that would be my response. Chris, do you have anything?
Yeah, I think that especially let us know if there are credentialing or as I think Natasha had raised, recurring exam types of things that need to be addressed in some of these issues, so that we can then point to where does this problem need to be solved. I think that's one of the key things we'll need to know, because this is certainly an area where our workforce is. I mean, we already have challenges keeping our workforce engaged as it is, with driver turnover, and now we're in a time where it can just become even more of a challenge, because I think we'll need to find ways to quickly onboard new personnel quicker than we normally do, and if we're engaged in contracts where we're required to do a certain type of thing, what can we do outside the scope of that contract, especially in the medical space. One of the things that I worry about is that it's one thing to be grant funded. You can go to your funding agency and say, hey, can we get some leeway here? It's another thing when you're under contract with someone and they're saying, these are the terms of the contract, and at what point does this current pandemic become a situation where you can exercise claim force majeure or something like that to renegotiate some of the contractual provisions. So we'll kind of need to know some details there and see what we can help you find out and help you explore.
Definitely. Yeah, let us know if there's anything on that end that we can pass along. Along with those kind of contractual things, if you're either working with a broker or you're working with a state Medicaid agency, some of those will have to be negotiated on a contract by contract basis, is my guess, at least at this time. I wish I had more guidance there, but that will likely come down to the Medicaid agency's decision there. Couple other questions that are coming in. One is around HIPAA rules and HIPAA compliance. It has been eased slightly at this time. I know Scott sent me an email about that just the other day. So just know, particularly around telehealth or things like that, we are seeing some changing rules on compliance there. So if that's another area you're facing burdens, let us know, and we might be able to share that information as well. One of the biggest things I'm seeing here in these comments is a concern about lost trips and the cost associated with that. Can suggestions be made to federal government about unemployment benefits for employees that are losing work? What happens in terms of paying insurance and lost business due to decreased rides? These are all really great points. Chris and Scott, I don't know if you want to talk about if that's been included so far in any discussions or ways that we could include that.
A couple things. One is, if, as we were saying earlier, if you are experiencing a loss in revenue, we need to know, we'd really like to hear from you the extent and the nature of that lost revenue, so that we can quantify that to help make you and your colleagues, your peers, whole on that front. So lost revenue types of things definitely not yet been addressed, but that's part of what this $1 trillion next bill is supposed to be engaging with throughout many sectors of the economy, including what we're doing in transportation. If you are experiencing, if you're curtailing service just because there's not as much demand for trips, let us know that the extent to which service is cut back. I will say on one front, I mean, this is going to sound kind of tragic, but at least it's being addressed. Is the bill that has already been signed into law addressed some, as I recall, or the one that's pending, one of those two address increased unemployment benefits. If you're in one of those sad spots where you're having to terminate employees, lay people off, salaried workers that or wage earning workers that are no longer employed are going to be eligible for unemployment compensation under slightly different terms than traditional unemployment benefits. Again, that's not, I mean, I don't like having to say that that's the answer, but at least it's being addressed. And if you're having kind of more existential crises, and in a lot of especially economically distressed rural areas, we might be looking at things where you're looking around and says, how much longer will I even be able to be in business? Let us know some of those parameters so that, again, I can't promise you a solution, but at least we need to know the scope of the problem so that we can hope that something comes through that can keep you engaged in providing vital services. In one area, for instance, as I'm looking at areas is if you're not using CDL drivers, there are a lot of folks that are going to be unemployed soon. Maybe we can find ways to quickly onboard them and put them to work for us. Who knows? That's kind of a silver lining in an otherwise dark cloud, but we do need to know some of those specifics. There's something else I was going to say, but I'll save that for later.
Hey, this is Scott. I'll address Dave Fitzgerald's question about drive-up coronavirus test centers. Yes, we have talked to members earlier today who are being asked to do those trips. And, our response was, if you can do that in a way that you view as safe, it's necessary. And I think dealing with that issue and understanding that as they ramp up the number of tests and start to get those out there, there's going to be a lot more of those types of trips. So for NEMT members, you ought to be coming up with how you're going to do that safely and where a trip like that sits within your priority list.
Thanks, Scott. And similar, I see Raymond asked if agencies are moving to fare-free to limit person-to-person interaction. We have heard from a few agencies that are doing that. They're either, not accepting fares, or they're asking people to board in the back. For larger vehicles, asking them to board in the back door, things like that. Some systems are even, if you're in a smaller vehicle, requesting riders not sit either right next to or right behind the driver, but in a separate seat that's slightly farther away. So those things are happening. We'll see if we can get additional guidance on any of that and be sure to share it. And then the last question we have listed here is around providing relief for companies with high turnover and drivers quitting due to fears or illness. I would encourage you to submit any thoughts or data you're already collecting on this in our Google form. Scott and Chris, I don't know if you have any other thoughts on this point before we wrap everything up.
No, but I mean, this gets to the most dire situation, and Edgar's question is real. We are going to provide you with links and information about the funding for private sector, small business administration loans, those things that are out there, and we will get you as much information as we can from them as well. We will make sure that and for all of our members that driver pay, the ability to keep your driving force is dealt with in these funding programs that the government is putting together, because without them we won't be able to provide the services.
I think we're about ready to wrap up, Scott. The last two questions are either comments or kind of questions around sanitizing and substitutions for sanitizing supplies. I know we got a few other questions on that in the two other webinars that we hosted today with our small urban and our rural providers. So be on the lookout for our summary content, and we'll be sure to include any insights and recommendations we can get on that there. So Scott, I think that's all you.
Thanks, Alex. And thanks everyone for joining. I know how busy everyone is right now, and to give us 45 minutes of your time is precious, and we appreciate that. I hope you found some information. I wish we had answers, definitive answers to all those questions, but I can assure you that we're going to work to get those for you. We will continue to provide additional information on the website that you see the URL listed. My email, Taylor's email, and Chris's email are right there. Fire away with emails directly to us. Again, we will do our best to get any questions you have answered. I can't guarantee that you'll always like the answers, but we know that accurate, timely information is a very valuable resource right now. And we want to make sure that at the very least, we can provide you access to that. You know, in closing, I wish you all good health to you and your families. Continue to do the important work that you do in your communities. It's never been more important, frankly, than it is right now. And you know, this too will pass, and there will be an end game to this. And we just want to make sure that you're all healthy and around for the rebound from this. And you know, when it comes to NEMT operations, we've known from the beginning that you know, your operations are truly on the front line of this crisis. So again, keep up the great work you're doing, and let us know how we can help. And thanks for joining us today. Take care.